My name is Randy Bigley. Joining me on the podcast right now from Marion Crawford Prevention Programs, Christie Eckert is with me. Good morning, Christie.
Good morning, Randy.
How are you doing, by the way?
I'm doing well, thank you.
Good. You got so much going on with you guys do so much, and like I said, there's always something happening or something.
Yes. We're busy. This month we're talking about stigma reduction, though.
Well, and that's a big thing. I mean, it shouldn't be that way, but it is, isn't it?
Yeah.
I mean, there's people that don't get treatment because they're afraid that maybe somebody thinks you're crazy or something, but you're not crazy.
No. And, we know that substance use disorders are chronic and treatable medical conditions. And studies show people with these disorders still face discrimination and stigma, and that can impact their health and well-being in a number of ways.
It can prevent them from getting help, right?
Exactly. Yeah. I mean, it can prevent them from getting help. A lot of times families are afraid to reach out for help, for themselves because they don't want to be stigmatized by what's going on. Employment, a lot of times even when a person's in recovery, a lot of places don't want someone who's been in recovery. So those second chance employers are amazing when we have them. But there's so much stigma around substance use and even recovery, which is the person getting themselves healthy. And that's sad. It
is sad. And like I said, and unfortunately, there's people that maybe be here today if they would have went and gotten help, right?
Exactly. We lose a lot of people because they're afraid to say what's going on. People don't want to tell others their business, and it's okay to have struggles. We all have struggles.
Right.
So let people help. And there are so many people that do want to help those individuals. So, but stigma does really affect that.
It does. Let's just talk about that a little bit. How does it affect somebody?
Sure. I mean, we talk about language, for instance. We all have had negative self-talk. We've all talked about, you look in the mirror and you're like, oh, you look awful today or whatever. But when we hear different things like that, that stigma kind of just reinforces that for that person in recovery, trying to get themselves well. Language matters. We in our industry are shifting a lot of the things. We used to say an alcoholic or a drug addict. And they're negative connotations. And yes, maybe the behavior isn't the healthiest, but it's a disease, and it's not a choice to be in that position. So we've even changed our words to be, a person with a substance use disorder. They're still a person. They're a human being.
Yeah.
And so, changing that tone, because we even still see it with health professionals, still saying, oh, he's an addict, or I'm that's negative. And again, it's not a choice, it's a disease. So, watching the way you say things, and, even alcoholic, a person with an alcohol use disorder or just a substance use disorder is fine. So, but we see a lot of people, that just kind of feeds into that negative connotation and makes them feel like, okay, I am a piece of trash. I'm not worth be taken care of. I'm not worth getting healthy. And that is completely untrue. Right. Everybody can get help with the proper supports.
And support is out there too, right?
There is. There's lots of support. There's counseling centers and medical professionals that can help with that. There's also those mental health providers to help with that piece of the mental piece with it. There's supports for families. But they, again, if people feel like they're afraid to tell others that they'll be stigmatized, or maybe if they do have a current job and they don't want to tell their boss, hey, I have a problem and I need to get myself well. I'm sick. It's no different than a person being sick with cancer.
Right,
it's a disease. They need to get themselves well. If somebody came to you and said, I have cancer, I need to take some time off to get well, everybody would say, oh, well, let's get you well. But when a person comes to someone sometimes with substance use disorder or addiction issues, they're like, well, I'm sorry, we can't do that. It's the same thing. They're diseases.
They sure are, exactly. Is there effective way? I mean, what can somebody do? Is there ways to help somebody out? I mean,
Yeah, I think there's a lot of different ways. There's ways to communicate with people, again, using that smart language and saying you're worth being well. Your life is worth having a healthy, strong life. There are medications that you can have, naloxone or Narcan, and we do have in Crawford County 2 free vending machines, one at our Bucyrus Avita Hospital and one at our Gallion Avita Hospital. If you're a family member of someone who is using opioids, have that on hand. You know, that is a life-saving drug that can save someone who has overdosed. You know, understanding that, again, I heard it's been a couple years ago, Surgeon General say, every life is worth saving, and we cannot get a dead person into treatment.
Right.
So saving that life, using those tools to have on hand, if you know someone, or even someone who is elderly, or someone who could mistake their medication. Not all overdoses come from people who have a substance use disorder. Some of them are accidental because they took too much medicine or forgot how much they took. So having those things, and then a stigma around having that medication. So many people say, well, I don't need that. I don't need that. What does it hurt if you carry it in your purse?
Right.
You know, I'd have it with me all the time. And you know, I don't know where I'll be. Maybe it's at the Walmart. Maybe it's at a football game. Maybe it's just walking down the street. Maybe it's at a gas station, but I may need it. And if I can save a life and that's the tool I have to have, then, you know, so be it. I think it's important to carry it.
You get a free. I know the health department has it here.
Yeah.
And just ask them. They'll be glad. In fact, they love to give it.
They love to give it.
Yeah. So I mean, it's available out there.
It is, and it's great to have on hand. So you know, knowing we know how to do CPR. So it's kind of the same thing. You know, those people that know how to do CPR. This is a saving mechanism, just like CPR.
Yeah, there you go, and it's available for free, and you may have to save somebody's life someday. Right?
Exactly.
Yeah. Excellent. Does the Marion Crawford Prevention? You guys help out if people need information on something?
Yes, you can visit Facebook pages actually for our Crawford Prevention Coalition or our Drug Free Marion Coalition. All of the different information is around that, and we do have an exciting event coming up in Crawford County. It's our efforts to reduce stigma around addiction and recovery on Saturday, August 10th from 5 to 8, and this is a completely free event. We're hosting it at the Gallion Community Theater. They are gracious enough to have us there again this year. This is our second annual, and it's just a really hopeful evening, pairing individuals in recovery with an artist who then creates a piece of work around their story.
Wow.
It is so hopeful. Avita will be providing snacks, and we'll have coffee and water and lemonade, and it's just a really neat night to celebrate those people who've worked really hard and share their story of hope and their journey with you, and it's amazing. It's very touching. I will tell you, I cried quite a bit last year.
I bet, yeah.
But yeah, we're very excited about that on August 10th from 5 to 8.
Awesome. So come on. I mean, that's got to be a beautiful event.
It is. If you want to feel good when you leave somewhere, that is one event that will do it. And again, it's free. So.
Awesome. Very cool. Thank you so much for coming in. Again, if people want more information about the Marion Crawford Prevention Programs, how can they do that?
Yeah, check us out on Facebook, specifically the Crawford Prevention Coalition or the Drug Free Marion Coalition. Both have Facebook pages, and we have all kinds of information there.
All right. Again, Saturday, August 10th, 5 to 8, Gallion Community Theater, right?
Yes,
and then it's free to come in and check out.
Free for everybody.
And freshmen will be there.
Yes.
So there you go. Thank you so much,
Thanks,
Christie.
Randy.
Thank you.